Do you know if there are dangers lurking in your medicine cabinet? We have this report from our executive producer, Roland Perez.
It's a common mistake anyone can make. We take lots of medication for various medical problems because we see multiple doctors who are all trying to make us feel better. But how do we know what we're taking is safe? I sat down with Dr. Jack Cox of Hoag Hospital in Newport Beach to discuss who's responsible for what we take and where we can get some help.
The real expert of your health should be you. You really need to know what you're taking. You need to know what you're taking as far as not only the number of medications and the different types of medications, but also how they interact with the foods you eat, with the supplements that you take, and also if you go to a physician for a new illness and they give you another prescription, it's important to know what you're already on because of the drug-drug interaction that so many individuals could get into problems with. The problem as the population ages, we have so many subspecialists that we go to, and each has their own group of medications that they may put you on. The heart physician, the cardiologist, the dermatologist, the gastroenterologist. And the problem is, how do you know that the medications the cardiologist is giving you is not interacting with what the gastroenterologist gives you? Again, so important that you are the expert on your own medications. One of the ways to keep safe that we recommend for individuals is go to a single pharmacy. If you go to a single pharmacy to get all of your prescriptions done, regardless of the physician who writes the prescriptions, oftentimes the pharmacist has software in the background that he or she is running so that as they put in a new medication for you, they can understand and know what interactions may happen. Also, some pharmacies will print lists of all the medications that you're on so that you can carry those with you. So if you ever go to another physician or you go to the emergency room, you have that list right there with you. Very, very important to know all the medications that you're on. Pharmacists today, particularly clinical pharmacists, are individuals that are trained during their pharmacy training to help educate patients about the medications that they're taking. For example, we have multiple individuals that have artificial heart valves. They're on a blood thinner like Coumadin. Did you know that you can't eat spinach with Coumadin because it increases the effect of the Coumadin? Many people are on statins. Did you know, for example, that you really shouldn't be eating grapefruit with Lipitor because it increases the effect and actually can cause muscle pain with that statin? There are certain medications you shouldn't take at the same time or that you shouldn't take at all together. A pharmacist, and it's important that individuals understand that, use that educational help that a pharmacist can give you, particularly when you're picking up a new medication. We also know that individuals oftentimes will come into our emergency room and have no clue of what medications they're on, which really hurts the physician in trying to determine, what medication should I put an individual on? Will it react with what they're already on? Could what I'm seeing be a reaction to a medication that an individual is already on? So the medication safety campaign that Hoag is really launching is to help individuals copy down those medications. If you go to Hoag's website, you actually can get to a medication card that you can put your medications on, carry it in your billfold or your pocketbook, so that if something happens, if you need the services of an emergency room, you know that you have that list with you. You can show the physicians and they'll be able to help you even quicker.
To prevent prescription errors, we should take these important steps. 1. Understand the drug's purpose. 2. Know your other medications. 3. Stick to one pharmacy. 4. Speak with a pharmacist. 5. Inspect your pills. 6. Ask about side effects. 7. Know your dosage. 8. Check diet restrictions. 9. Don't assume. If you refill a prescription and the medication looks different in any way, tell the pharmacist. These 9 important steps should keep you out of trouble. For the American Health Journal, I'm Roland Perez.